Applications of Psychological Testing by Valeri L Reaves, PSY640, Psychological Testing, Dr. Jeral Kurwin. This presentation is a review of two clients and the psychological assessments that were utilized by psychology professionals to diagnose, prognose, and develop treatment plans for them. Mr. I. Mr. I's age is inconsistent throughout the report. His date of birth is not noted. He is said to be 36 or 46 years of age. He is married. His education and occupation are not reported. Mr. I's originating concerns were suicidal ideations, psychotic and delusional thinking, poor sleep patterns, religious preoccupations, assaultive behavior, and memory and concentration issues. Miss S. Miss S is a 29-year-old married woman. Her date of birth is noted as January 1st, 1985. She has completed 12 years of education, currently works part-time, and is a college student. The date of her evaluation is July 1st, 2014. Miss S's original concerns were anxiety, depression, difficulty with math, and memory and concentration issues. Mr. I Ethical Standards, Section 9.04. Due to Mr. I's suicidal ideations, aggressive behaviors, and cognitive difficulties, an individual one-on-one environment may need to be set up for him as opposed to a group setting. Individual testing should be in interview style as opposed to self-report pencil to paper to ensure proper completion of all scales. Miss S. Ethical Standards, Section 9.02 and 9.06. Due to Miss S's diagnosed anxiety disorder, a customized environment may need to be set up for her. As well, additional time to complete the assessment may be necessary. Consideration of Miss S's anxiety disorder and difficulty with focus should be applied when interpreting data collected in assessments. Analysis of psychometric methodologies. Data collection regarding a client is called psychometric methodology. Psychometric refers to the theory and technique of a psychological measure, such as a test, measure, instrument, or assessment. Methodology refers to the process or method involved in data collection. For the purpose of data collection regarding Mr. I's personality and behavior, he completed the Minnesota Multiphasic Personality Inventory-2 restructured form, after which time a computer-generated report was received. The key factors of the test were focused on emotional internalized dysfunction, thought dysfunction, and behavior externalizing dysfunction. The validity of Mr. I's testing is in question due to a score of less than 90% questions answered in several sections: symptom validity, adjustment validity, cynicism, and aesthetic literature interest. In the case of Miss S, the psychometric methodology utilized was a combination of several assessments: a personality assessment called the MMPR-2RF, two mood assessments called the Beck Depression Inventory and the Beck Anxiety Inventory, a cognitive assessment called the Wechsler Adult Intelligence Scale-4, an achievement assessment called the Nelson-Denny Reading Test Form G, the Wide Range Achievement Test -4, and several information processing tests. Some of Mrs. S' testing results were below average. This low rating may be a direct result of anxiety, attentional factors, and/or difficulty with working memory and mathematics. Ms. S was tested in the traditional standard and later retested with extended time to take some of the tests. Overall, her scores were improved with additional time allotment to take the test with less distractions. Additional tests: personality, emotional functioning. For Mr. I, the recommendation for additional testing would be to have a neuropsychological evaluation to determine strengths and weaknesses of his brain functioning relative to aggressive behaviors and cognitive concerns, including the HRB, the CT scan, the MRI, and the PET scan. For Ms. S, the recommendation for additional testing would be to continue utilizing the same assessments with a designated elapsed time between each testing session. The purpose of this retesting would be to determine if a familiarity and comfort with the testing instruments showed an improvement in her scores. Also, to administer the severity of post-traumatic stress symptom adult, short scale, regarding her military experiences and the severity of any residual effects from witnessing the murder of her fellow comrade. Justification of additional assessments. Justification of additional assessment recommendations is established by review of validity of previous assessments performed, originating concerns, diagnosis, and prognosis. Mr. I's assessment validation is called into question because portions of several scales were left unanswered. He presented with suicidal ideations, aggressive behaviors, poor sleep patterns, religious preoccupation, and psychotic and delusional thinking. He was diagnosed with cycling mood disorder, schizoaffective disorder with manic or hypomanic episodes, and intermediate explosive disorders, along with suicidal and persecutorial thoughts. His prognosis is stabilization of conditions with medication. Ms. S's assessment validation was established, with a side note of some exaggeration in portions of some scales. She presented with anxiety, depression, post-traumatic stress, medical illness involving multiple surgeries, and weight control issues. She was diagnosed with generalized anxiety disorder, mathematics disorder, sustained attention and working memory impairments. Her prognosis is a stabilization by utilizing behavior strategies to address conditions. Notification of findings to Ms. S. Hello, Ms. S. My name is Valeri Reaves. Thank you for coming in to meet with me today regarding the results of your assessments. After reviewing the results of your assessments, it has been determined that, for the most part, you performed at an average level. However, there was some evidence of difficulty with mathematics, such that which would indicate what we call a mathematics disorder. It appears that your reported anxiety and loss of attention span was observed during the testing. Both the anxiety and the loss of attention span seem to have played a role in your lower scores in both mathematics and reading. You perform best when you are allowed additional time to take tests. It is advised that you request extra time when taking tests. The recommendation is that you continue cognitive behavioral therapy to continue working through the anxiety and memory issues. Also, it is recommended that you meet with a licensed professional, such as a counselor or therapist, to work through the experiences that you had while in the military. Do you have any questions or concerns regarding the information that we have just discussed? If you think of something later, here is my contact information. I am also providing you with some contact referral information for therapeutic services.